glucose and refits and thrombin interpreted for atrial fibrillation and acute coronary syndrome or PCE. Definition: thrombosis is the formation of the knot on the thrombus with a bolus. A present ball form flowing normality through the circulatory system. This can lead to very severe condition, and even because of them. The antibiotic therapy will use the will atrial fibrillation of the cause coronary syndrome underlies the PCS, percussion coronary interventions. Application in nursing. Thrombosis causes an immediate and prolonged propagulous response of the finish, the infusions, with the concept prophylaxis thrombosis effect. This affects the exhale for thrombus contains the artery. Liver thrombosis acts after the platelets and the air coagulation cascade. Pro and cons. This data of the percentage is for freaks in the test population the model 9. The theory cause the virus of the itself if anemia or the end coronary embolus. Invasive stress requires the shift in the antibiotic medication regimen, with its always association with a heal in the hemorrhage. After an individualized examination of the cache age and conservation strains for case patients can be evaluations.
The interstim system gently stimulates the sacral nerves in your pelvic area that control your bowel, helping to restore bowel-brain communication and reduce your symptoms.
Use application in Ecuador. Utensil Reciclates International Cardiology we recruited on the performed on the coronary characterizations in the full anticoagulant patients. The radial approach and the dual problems of the patient We have with chance in coagulation in the goto with the use breath therapy with helping give the increase on the thrombolysis and hemorrhagic risk. Tax this instance. Conclusion. Patients with of the first we sense are high-risk populations with the heart comorbidity. In the recent years, the service structures have been proven from the experts. Consequences documented. And on the roots, the risk of the hemorrhagic with increasing the risk thrombosis.
Thank you for visiting Dr. AFib. I'm Dr. Morales. In this segment, we'll be talking about risk factors for developing atrial fibrillation. When I first meet a patient that gets first diagnosed with AFib, they frequently ask, why did I get this condition? A lot of times when people are first diagnosed, they get told that it's because of a medication or stress in their lives or a laboratory abnormality like low magnesium. Although there are certain medications as well as low magnesium which have been contributed to getting episodes of atrial fibrillation, it doesn't necessarily cause the chronic condition of atrial fibrillation. Frequently, there's a lot more common risk factors that lead to developments of atrial fibrillation. The most common of these risk factors is age. As people get over 60 years of age, the incidence of AFib increases to where the prevalence of atrial fibrillation once people get up to 80 years old can be up to 10%. This is mostly due to what we call as age-related fibrosis, basically developing scar tissue inside of your heart. Not that different to people developing wrinkles as they get older in life. Other common risk factors for developing AFib are high blood pressure and diabetes. Having had a past heart history increases your risk for atrial fibrillation, which includes coronary artery disease, meaning you have blockages in the arteries of your heart, or you've had stents or past heart attacks, congestive heart failure, or valvular heart disease, particularly mitral valve heart disease. Having had a past surgery on your heart increases your risk for atrial fibrillation, which can include bypass surgery or past valve surgery. Family history increases your risk for atrial fibrillation as well. Although there's no single gene that is known to cause atrial fibrillation, there have been some genes that have been shown to have an association, and there's certainly a family history component to atrial fibrillation as well. Obesity increases your risk for atrial fibrillation, as does chronic lung disease such as COPD or emphysema. History of thyroid disease also increases your risk for atrial fibrillation, and it's important to keep your thyroid levels controlled if you've been diagnosed with this condition. Sleep apnea can cause this condition, especially when it's uncontrolled. Excessive alcohol or stimulant use can also be associated with development of atrial fibrillation, as well as smoking, European ancestry, serious illness, or infection. It's not uncommon when patients are in the hospital and dealing with either serious infection or recovering from a surgery, for example, that they develop episodes of atrial fibrillation. Thank you for visiting Dr. AFib. In my next segment, I will be talking about risk of stroke,